How is bladder squamous cell carcinoma prognosis determined? When it comes to bladder squamous cell carcinoma, or SCC, understanding the prognosis can feel overwhelming. The prognosis is influenced by several important factors that help doctors predict outcomes and guide treatment. Let's break these down in a straightforward way. First, the stage of the tumor is crucial. This refers to how far the cancer has spread. If the tumor is still in the superficial layers of the bladder, the outlook is generally better. However, if it has invaded deeper into the bladder muscle or spread to lymph nodes or other organs, the prognosis worsens significantly. Unfortunately, many cases of bladder SCC are diagnosed at a later stage, which contributes to a poorer prognosis. Next, we look at the tumor grade. This indicates how much the cancer cells differ from normal bladder cells. High-grade tumors are more aggressive and have a higher chance of spreading. Bladder SCC is often high-grade, which adds to its challenging nature. Another important factor is lymphovascular invasion and lymph node involvement. If cancer cells are found in the lymphatic or blood vessels, or if lymph nodes are affected, this suggests a higher risk of the cancer spreading. These findings are key indicators that doctors use to assess prognosis. Local recurrence and metastasis also play a role. Most deaths from bladder SCC occur due to local recurrences rather than distant spread. Recurrences often happen at surgical connection sites, like where the bladder connects to the urethra. While distant metastases are less common, they can still occur, particularly in cases not related to certain infections. Patient-specific factors, such as age and overall health, are also significant. The type of treatment a patient receives, like surgery or chemotherapy, can influence outcomes. Surgery, especially radical cystectomy, combined with chemotherapy may improve survival chances, but bladder SCC is rare, which limits large studies to establish standard treatments. Emerging research is also exploring molecular biomarkers that might predict the aggressiveness of the disease. For instance, markers like fibroblast growth factor 2 and epidermal growth factor receptor could help tailor treatment in the future, though they are not yet routinely used for prognosis. Lastly, survival rates for bladder SCC are generally lower compared to other bladder cancers, with 5-year survival rates ranging from about 33% to 48%. This reflects the aggressive nature of the disease and the tendency for late diagnosis. In summary, the prognosis for bladder squamous cell carcinoma is determined by tumor stage, grade, lymph node involvement, recurrence risk, patient factors, and emerging biomarkers. Given the rarity and often late diagnosis of bladder SCC, the prognosis can be poor. This highlights the importance of early detection and comprehensive treatment planning with healthcare professionals who specialize in bladder cancer. Always consult with a healthcare provider for personalized advice and treatment options.